Vitamin D is actually not a vitamin but rather a hormone that is produced in the body as a result of sun exposure. It can also be obtained from certain foods. The importance of vitamin D. This hormone absorbs calcium from the food in the digestive system to the body. So its lack may lead to a decrease in the absorption of calcium from the food. As a result, calcium is released from the bones to maintain a stable calcium level in the blood. This results in bone injuries, rickets in children, rickets or osteoporosis in adults, damage to the muscles that have blood pressure. There is also research confirming the existence of a relationship between low levels of vitamin D and diabetes, autoimmune diseases in which the immune system attacks the body, such as lupus, SLE, and certain types of cancerous tumors. Vitamin D deficiency is a very common condition among adults and children alike. The issue seems to stem from a lack of exposure to the sun and the large use of sunscreen products in recent years following increased awareness of the health risks associated with increased exposure to the sun, such as an increased risk of skin cancer. Excess vitamin D is a condition so rare that it requires large amounts of consumption. In excess cases, this excess causes high blood pressure, weakness, high calcium in the blood, kidney stones and decreased ability to concentrate. Vitamin D test actually checks the level of one of its products, 25-hydroxy-vitamin D250H vitamin D. Vitamin D test results low, less than 15 nanograms per liter, 37 nmol per liter. Today, vitamin D deficiency is considered a result of insufficient consumption of vitamin D. Vitamin D is found in certain types of fish, shiitake fungi, egg white, negligible amount, and products that are artificially added vitamin D in most additive milk products. There is no vitamin D when needed. Vitamin D can be supplemented with commercial preparations. Consumption of 400 units per day. In the event of a shortage or pregnancy, 800 to 1,000 units can be consumed. Insufficient exposure to sunlight. It is common in children, people working in closed places, and people who wear long clothes throughout the year for religious reasons. Also, people with dark skin who use a protection product may also be exposed to not absorbing the quantity and sufficient of sunlight to produce vitamin D. There is no medical recommendation for exposure to the sun more than using or not using the protection product, for fear of skin cancer. If you have vitamin D deficiency, you can moderate sun exposure, for several minutes a day, in safe hours. Problems absorbing vitamin D are caused by digestive problems. In adults, due to the reduced ability of the kidneys to convert vitamin D to the active ingredient. Joint level, between 15 nanograms of upgrade 37 nmol per liter and 25 nanograms per liter 62 nmol per liter, considered as a articular state. Good level, above 25 nanograms of upgrade 67 nmol per liter, is a good level for most people, but there is a prevailing view that people in risk groups with me, such as pregnant women, the infirm, people with kidney problems and children with a family history of Crohn's disease, diabetes or rheumatoid disease, it is preferable to maintain a degree above 30-50 nanograms per liter 74,123 nmol/L. Excess level, above 150 nanograms for the upgrade 370 nmol for the upgrade, is considered a vitamin D surplus, but this limit is different, and there are those who believe that the value should be greater. The level of vitamin D in the blood can be high due to diseases that produce granules, granulomas, such as tuberculosis, sarcoidosis, and hyperthyroidism. At risk group, there is no risk in this test for the risks involved in a regular blood test. Related diseases: vitamin D deficiency, vitamin D surplus, rickets, osteoporosis, hyperthyroidism, hyperparathyroidism, high level of calcium in the blood, hypercalcemia, kidney stones, tuberculosis, sarcoidosis. When should the examination be done? In adults with osteoporosis, a disease that is low in bone density, high blood pressure or kidney injury. When in doubt about hyperthyroidism, hyperparathyroidism, tuberculosis, or sarcoidosis. In children with suspicion of rickets, this disease appears as growth retardation and bone deformation, as a screening test for vitamin D deficiency in adults, children and pregnant women. Method of conducting the examination: this is a regular blood test. Women and vitamin D. The disappearance of estrogen in postmenopausal women has a negative effect on the production of minerals, due to the decrease in the production of dihydroxyvitamins 1,25D and the decrease in the amount of receptors for dihydroxyvitamins 1,25D. The decrease in the level and activity of dihydroxyvitamin 1,25D increases the activity of the thyroid gland and promotes osteoporosis, which leads to osteoporosis. In addition, 2 hereditary diseases are known to be the result of the body's resistance to vitamin D. In the first type, there is a very low production of 1,25D dihydroxy. The second type is characterized by the absence of receptors for dihydroxyvitamin 1,25D in the target cells. Either way, the symptoms are due to a vitamin D deficiency. Symptoms of a vitamin D deficiency. Symptoms of a vitamin D deficiency include chronic fatigue, chronic and persistent pain in different parts of the body, autoimmune diseases such as multiple sclerosis, arthritis, etc. Osteoporosis, a slow weakening of the bone as a result of depletion of calcium in the body, heart disease progression, high blood pressure and heart attacks. Complications of vitamin D deficiency. Osteoporosis is a classic symptom that is associated with a deficiency of vitamin D in the body. The effect of vitamin D deficiency. Vitamin D deficiency affects humans as follows. Vitamin deficiency, especially in children, causes fragile diseases that result in severe deformations in the structure and bones of the limbs. In adults, a deficiency in vitamin D may lead to muscle and bone weakness. The population at greatest risk of developing vitamin D deficiency is the elderly, overweight people, breastfeeding women, people who expose their bodies to a limited exposure to sunlight, people with cystic fibrosis or inflammatory diseases of the intestine, Crohn's disease. Vitamin D deficiency treatment. Treatment for vitamin D deficiency is by sun exposure. Eat foods rich in or fortified with vitamin D. Take vitamin-containing pills. Intravenous vitamin injection. For patients with metabolic disorders, they are treated with 1,25D dihydroxyvitamin or its synthetic analogs. Don't forget to leave a comment and we will reply to it, and press the subscribe button below.